Scott Atlas is one of the leading physicians in the world. He wrote the book on magnetic resonance imaging of the brain and the spine. And somehow, in the course of writing on that, he developed both. And his is strong. He did work for the president, President Trump, for a while. And the point is, it's such a violent culture today that for a leading scientist to offer his counsel to the President of the United States, when there are people dying, as there are, and that is a disgrace, that tells you where the country is. I say he's a cause for optimism, because I didn't know him before any of this came up. And so that means that I, and all of us, every one of us, has discovered a brave and brilliant man. And the only correct conclusion to draw from that is there must be more, and we are stronger by knowing him. Please come up here, Scott. As you know, Hillsdale College is very old, not long in the tooth. And this award that I'm about to give Scott, we've been giving it for more than 40 years. And we've given it to Ronald Reagan, and we've given it to Margaret Thatcher, and we've given it to Clarence Thomas, and some other small names. And it's called the Freedom Leadership Award. And that means leadership, which takes courage toward freedom, which has a generosity to everyone it touches. I'm proud to present this award to Scott Atlas.
Thank you so much. Thank you, President Arnn, supporters of Hillsdale and Hillsdale's National Leadership Seminar Program, and members of this distinguished audience. It's a great honor to be here. It's my first exposure to Hillsdale, and it's awesome. I am really thrilled to be here. I'm very, very grateful to receive the award. I'm, of course, highly honored to be on the list of winners, and I sincerely thank everyone who had anything to do with this. It's also great to be in a crowd that is friendly for a change. Hillsdale's National Leadership Seminar Program, as everyone here knows, was founded with a specific mission, quote, to foster enlightened leadership and informed decision-making for America's third century by communicating the fundamental principles of freedom and order on which Western civilization is based, unquote. The pandemic has been a tragedy, no doubt, but it has exposed profound issues in America that now threaten those very principles of freedom and order that we Americans too often take for granted. First, I must say I was shocked at the enormous power of the government to unilaterally decree to simply close businesses and schools, restrict personal movement, mandate behavior, eliminate our most basic freedoms without any end. And second, I was and I remain stunned and a little bit frightened at the acquiescence of the American people to these destructive, arbitrary, and wholly unscientific rules, restrictions, and mandates. This crisis also exposed what we have all known existed, but we tolerated, although I think Hillsdale didn't tolerate it as much as everyone else. But the rest of the country tolerated for years the bias of the media, the suppression of academic freedom on campuses, the lack of neutrality in big tech, and now more obviously than ever, the politicization of science. Ultimately, the freedom to seek and state the truth is at risk here in the United States. First, we all acknowledge the consequences of the SARS-2 coronavirus pandemic and its management have been enormous. Over 500,000 American deaths have been attributed to the virus. More will certainly follow. Even after a year, the pandemic still paralyzes our country, and despite all efforts, there has been an undeniable failure to stop the cases from rapidly escalating and preventing hospitalizations and death. But here's the unacknowledged reality. Almost every state and major city has implemented severe restrictions for many months, including closures of businesses and in-person schools, mobility restrictions, curfews, quarantines, limits on groups and families, and mask mandates dating back to at least the summer. And let's clear up the myths about the behavior of Americans. Social mobility tracking and data from Gallup, YouGov, the COVID-19 Consortium, and the CDC have shown significant reductions of movement, as well as consistently high percentage of mask wearing since late last summer, similar to Western Europe and approaching that in Asia. There is no truth to the fact that these mandates were not obeyed. All legitimate policy scholars today should be re-examining policies that severely harmed Americans' families and children and failed to save the elderly. Numerous studies, including one from my current institution, Stanford University's infectious disease scientist and epidemiologist Ben David O. Bhattacharya and Ioannidis, have shown the mitigating impact of these extraordinary measures used in almost every state was small at best. President Biden openly admitted this lack of efficacy in his speech on January 22nd when he said, quote, "There is nothing we can do to change the trajectory of the pandemic in the next several months," unquote. Bizarrely, though, many want to blame those who oppose the lockdowns and the mandates for the failure of the lockdowns and the mandates that were widely implemented. Separate from their limited value, efficacy that has been grossly exaggerated in scientific journals, lockdown policies have been extraordinarily harmful. The harms to children of closing in-person schools are dramatic: poor learning, school dropouts, social isolation, suicidal ideation, most of which are far worse for lower-income families. A recent study confirms up to 78% of cancers were never detected due to misscreening over 3 months, and extrapolating to the entire country, over 1 million new cases over 9 months of cancer will have gone undetected. That disaster adds to missed surgeries, delayed presentations of pediatric illnesses, heart attack and stroke patients too afraid to call emergency services, and others, all well documented. Beyond hospital care, the CDC reported 4-fold increases in depression, tripling of anxiety symptoms, doubling of suicidal ideation, particularly among young adults. After the first few months of lockdowns, domestic abuse, child abuse skyrocketing due to the isolation and specifically to the loss of jobs, particularly in strict lockdown states. Given that many in-person schools have closed, hundreds of thousands of child abuse cases are not reported because schools are where child abuse is most frequently noted. Finally, the unemployment shock from the lockdowns, according to a recent NBER study, will generate almost 890,000 additional U.S. deaths, mainly in minority and poor families, over the next 15 years. That's the lockdown alone. We know we have not seen the full extent of the damage because it will last for decades. Perhaps that is why lockdowns were never recommended in previous pandemic analyses, even for infections with far higher death rates. To determine the best path forward, shouldn't policymakers now objectively consider both the virus harms and the totality of impact of the policies to date? That's the importance of health policy experts, my field. We have a broader scope of expertise than that of epidemiologists and basic scientists, who you see on TV every day. And that necessarily means admitting that social lockdowns and significant restrictions on individuals are deadly, extraordinarily harmful, especially on the working class, minorities, and the poor. Optimistically, we should be seeing the light at the end of the long tunnel now with the vaccine rollout. On the other hand, using logic that would put Alice in Wonderland's Mad Hatter to shame, the new vaccines were first more frequently administered to healthier, younger people instead of those at risk to die in most states. And now we hear children must be vaccinated before schools open when they have extremely low risk from this infection and are proven to not be significant spreaders to adults. Or the Kafkaesque nonsense that teachers must be vaccinated before they teach in person, when schools are one of the lowest risk environments and the vast majority of teachers are not high risk. Even worse, we hear the same old so-called experts on TV now warning that social distancing, masks, and other restrictions will still be necessary after vaccines. There is no intention of those in power to allow Americans to live normally, to live freely again, and don't ever think otherwise. Just as in Galileo's time, the real problem is what he called, quote, vested academic interests, unquote. Many universities, which should be America's centers for critical thinking, have overtly intimidated views contrary to their own, undoubtedly, undeniably out of political reasons, leaving many afraid to speak up. I know, I get their emails for months, people encouraging me but are afraid to step forward. But it is not only the matter of academic freedom that needs comment. Instead of rethinking the failed policies, some Stanford professors have chosen to employ toxic smears in opinion pieces and organized rebukes against those of us who disagreed with what was implemented, but worse, who dared to help the country under a president they despised, apparently the ultimate transgression. Defamatory attacks with malicious intent based on straw man arguments and out-of-context distortions are not acceptable in civilized society, let alone in our universities. In their attempt to intimidate and discredit me using falsifications and misrepresentations, a group of untruthful professors violated with impunity Stanford's code of conduct, damaged the Stanford name, and most importantly, abused the trust parents and society place in them to influence America's children, our next generation of leaders. This is unacceptable. It is understandable that most Stanford professors are not experts in my field, health policy, and even that most are ignorant of the data about the pandemic. But it is not acceptable to claim I made recommendations that were, quote, falsehoods and misrepresentations of science. That is a lie. And no matter how often a lie is repeated, and regardless of how often those lies are echoed in the media, lies do not transform into truths. We all must pray to God that the phrase attributed to Nazi propagandist Joseph Goebbels, quote, a lie told once remains a lie, but a lie told 1,000 times becomes the truth, unquote, never becomes true in these United States of America. All policy considerations I recommended to the president were designed to reduce both the spread of the virus to the most vulnerable and the harms to those impacted by the policies the most, the poor and working class of America. I was one of the first to push for increasing protections to those most at risk, particularly the elderly. Almost a year ago, I recognized we must consider the enormous harms to physical health, mental health, and lives lost coming directly from the draconian policies that attempted to contain the infection. That is the most appropriate goal of people in public health policy, to minimize all harms, not simply to stop COVID-19 at all costs. The claim in a recent Journal of the AMA opinion piece, a vicious piece written by 3 Stanford professors, that said, quote, nearly all public health experts were concerned that Atlas's recommendations could lead to tens of thousands of unnecessary deaths in the United States alone, unquote, is patently false, absurd on its face. As Professor Arnn mentioned, the proposal called the Great Barrington Declaration, co-authored by some of the world's best medical scientists and epidemiologists from Stanford, Harvard, and Oxford, is, quote, far closer to the one condemned in the JAMA article than anything Atlas said, unquote, as pointed out by Zinberg. Yet that policy document has already been signed by over 50,000 medical and public health practitioners. When critics display such ignorance about the scope of views held by experts, it exposes their overt bias and wholly disqualifies their authority on these issues. Indeed, it is almost beyond parody that these same Stanford critics wrote, quote, professionalism demands honesty about what they know and do not know, unquote. It is true that I have explained the fact that younger people have little risk from this infection, as well as the biological concept of herd immunity, the most radioactive term in the pandemic discussion. That explanation is very different from proposing that people be deliberately exposed and infected. I have never done that. To the contrary, I have repeatedly called for mitigation measures, including extra sanitization, social distancing, masks when appropriate, group limits, testing, and other increased protections to limit the spread and the damage from the virus. I explicitly call for augmenting protection of those at risk in dozens of on-the-record presentations, interviews, and written pieces. Yet, one must question why these accusers ignore these explicit, emphatic denials of me beyond those presentations that I ever supported spreading the infection unchecked to achieve herd immunity. These denials were quoted widely in the media. Are not my own statements the object of their criticism in the first place? Or might it be something else? Might it be due to these Stanford professors' own political rage, their own desire to delegitimize anyone who had the audacity to help the country under President Trump? For many months, I was vilified after calling for opening in-person schools, the same exact policy that Harvard professors Martin Kulldorff and Catherine Yee and Stanford professor and my good friend Jay Bhattacharya called for. But this policy has been corroborated, upheld with all the evidence repeatedly for months. The compelling case to open schools is admitted to be longstanding truth now, even in lay publications like The Atlantic. They said, quote, research from around the world has since the beginning of the pandemic indicated that people under 18 and especially younger kids are less susceptible to infection, less likely to experience severe symptoms, and far less likely to be hospitalized or die, unquote. And, quote, we've known for months that young children are less susceptible to serious infection and less likely to transmit the virus. Let's act like it, unquote. The JAMA accusers further stated, Atlas disputed the need for masks, unquote. Talk about radioactive issues. Let's talk about masks. To the contrary, my advice on mask usage was consistent, and I said it more than 100 times. Wear a mask when you cannot socially distance, quote unquote. What's funny is that that matches almost verbatim the published recommendations of the World Health Organization. Quote, when outside, wear a mask if you cannot maintain physical distance from others, unquote. And in December, they changed it to, quote, in areas where the virus is circulating, masks should be worn when you're in crowded settings, when you can't be 1 meter from others, and in rooms with poor or unknown ventilation, unquote, i.e. not at all times by everyone. That also matches the NIH. Quote, when consistent distancing is not possible, face coverings may further reduce the spread of infectious droplets from individuals with SARS-2 COVID infection to others, unquote. You'll never hear that on CNN. You may not watch CNN. Let's talk about universal mask usage in the general population. 38 states have implemented mask mandates, most since at least the summer, with almost all the rest having major city mask mandates. Widespread general population mask usage has shown little empirical utility for stopping cases all over the world, every state in the country, even though describing that evidence has been censored. Widespread mass usage shows only minimal impact in the one large randomized controlled study from Denmark. Here's the reality. Those who insist that universal mask usage is absolutely proven effective at controlling the spread of this virus and somehow is universally recommended by the science are deliberately ignoring the evidence to the contrary, and they are propagating false and misleading information. Those who charge that it is unethical or dangerous to question broad population mask mandates must explain why several of the world's top infectious disease scientists and public health organizations overtly question the efficacy of general population masks. Jefferson and Hennigan of Oxford Center for Evidence-Based Medicine wrote, quote, it would appear that despite 2 decades of pandemic preparedness, there is considerable uncertainty as to the value of wearing masks, unquote. Oxford's Sunetra Gupta said there is no need for masks unless one is elderly or high risk. Stanford's Jay Bhattacharya stated, quote, mask mandates are not supported by the scientific data. There is no scientific evidence that mask mandates work to slow the spread of the disease, unquote. Throughout the pandemic, the WHO said, at present, there is no direct evidence on the effectiveness of universal masking of healthy people in the community to prevent infection with respiratory viruses, including COVID-19, unquote. The CDC reviewed influenza pandemics and published in May, quote, they did not find evidence that surgical-type face masks are effective in reducing laboratory-confirmed influenza transmission, either when worn by infected persons, source control, or by persons in the general community to reduce their susceptibility, unquote. And until the WHO removed the quote that I used of theirs in my tweet that was withdrawn and censored by Twitter, they had posted until the very next day, quote, at the present time, the widespread use of masks by healthy people in the community setting is not yet supported by high quality or direct scientific evidence, and there are potential benefits and harms to consider, period. At this point, one could make a strong case that those who continue to push societal restrictions without acknowledging their failures and serious harms are themselves putting forth dangerous misinformation. But I will not call for their official rebuke or punishment. I will not try to cancel them. I will not try to extinguish their opinions. And I will not lie to distort their words and defame them. To do so would repeat their shameful behavior of intimidating discourse that is critical to educating the public and arriving at the scientific truths we desperately need. It's time to consider that university models like Harvard's Truth, Stanford's The Winds of Freedom Blow, and Yale's Light and Truth need major revision. Social media has piled on with a heavy hand now to eliminate discussion of conflicting evidence. Without indeed encouraging open debate and admission of errors, we might never solve any future crisis. As a health policy scholar for over 15 years and as a professor at top universities for 30 years, I am shocked at what I see. Some faculty members of our acclaimed universities are now dangerously intolerant of opinions that they don't agree with. Some go even further, distorting and misrepresenting words to delegitimize and even calling for punishment of those of us willing to serve the country alongside a polarizing president that they happen to loathe. It is their behavior, to quote those same professors rebuking me, that, quote, violates the core values of Stanford faculty and the expectations under the Stanford Code of Conduct, which states, quote, we are all responsible for sustaining the high ethical standards of this institution, unquote. But worse than that violation of ethical behavior among colleagues, their behavior does not meet the standard of simple human decency. If academic leaders, if the entire academic community fails to stand up and renounce that unethical conduct, many more experts with a reputation to lose will be unwilling to serve their country in contentious times. As educators, as parents, as fellow citizens, that would be the worst possible legacy to leave to our children. I also fear that the concept, the science, has been seriously damaged. Even the best journals in the world, New England Journal of Medicine, Lancet, Science, Nature, and Journal of the AMA, have become overtly contaminated by politics. Many, unfortunately, have now become fatigued by these arguments. That is even worse, because if the public becomes fatigued, that will allow fallacy to triumph over truth. If the social media continues to be the arbiter of allowable discussion, the United States is on the precipice of losing its cherished freedoms, with censorship and cancellation of all those who bring views forward that differ from the accepted mainstream. I stand here honestly more renewed than I was when I walked in this building, because I have never seen Hillsdale College before. I will say this in conclusion: while it is not clear if our democracy will survive, it is obvious that people must step up, and I may say rise up, or it has no chance. Thank you very much. Thank you. Thank you very much. Thank you. Thank you very much.
Thank you, Dr. Atlas. We now have time for some Q&A. If you have a question, please raise your hand and wait for a microphone to be brought to you.
Sir, I am 75 years old and sort of on the horns of a dilemma, and that dilemma is whether or not to get the vaccination. So what's your opinion of what we should do under these circumstances?
Okay, this is a common question actually tonight before the dinner. So, I mean, I'll first say I'm not anybody's doctor here, and you should consult with your doctor. I can say this, and this is what I tell people. I think, and I've said it on the podium in the press briefing room, so I feel that people who are at risk should get the vaccine. And what I mean by that is, besides the people who have high-risk conditions, people who are generally over roughly 65, it's advisable to get the vaccine. And I say that for two reasons. One is that the risk of the vaccine is smaller than the risk from COVID-19 for people who are old. I consider myself, I don't consider myself old, but I did get the vaccine 2 days ago. And the second reason is a sort of a secondary reason, but it's the reality of the country we're living in and the world we're living in. I believe, I don't want it to be true, but I believe that we're probably going to be required to show that we had the vaccine before we're allowed to do certain things. I actually believe that. It's sad, but this is the world we're looking at. And what I'm talking about specifically is things like international travel. I believe, I have no inside knowledge on this, I'm not in the discussion at all, that countries could easily start requiring that, and I do travel quite a bit. So those two things, in the right age group, I think it's advisable to get the vaccine, and I think it probably will be required, although I have no inside knowledge on that. If you're asking me, should everyone get the vaccine, again, I'm going to say it's a personal decision with you and your doctor. I do not believe for 1 second that people should be required to get a vaccine. No, I am completely opposed to that. If you're low risk and young, I think there's a strong case to not take the vaccine. I have 2 children of my own in that age group, and I've advised them accordingly. But again, like, it's a personal decision. You know, there are certain risks. I would say this, if I can go on a little bit. I was there. From what I saw and what I know, there were no corners cut on the vaccine development. In fact, there were extra delays put in against standards to delay the emergency use authorization. So I do not believe at all that the vaccines were somehow short-circuiting safety measures. I disagree with that. There is a certain percentage of complications from any time you're going to inject into your body something. That's clear, and the vaccines are in that category. But it's a cost-benefit or a risk sort of benefit assessment for an individual.
We have a question on the speaker's left.
Dr. Atlas, I just recently read, and I can't say who quoted it, but it was a quote that's saying that those who had the coronavirus and then who recovered should only get the first shot of the inoculation. And I thought, presumably, if you've had the disease, you have the antibodies, you have the memory cells in your blood, what the heck is that about that they should get the first shot? Do you have an opinion on that? Have you heard that? I can't remember who said it.
Yes. So, I mean, there's 2 parts to that, really, that are important. One is, when you're talking about prioritizing vaccines, this is one of the things that is, again, like, this is, I've said on TV, I feel like I'm living in a Kafka novel here. I mean, there's never been anyone that says, in the administration or in the people that are in charge nowadays, that says that you should not be a priority if you had the infection. And of course, you should not be a priority. I'm not saying you should never take the vaccine, but you don't need it right away. You should immunize the people who have a high risk to die. And if you've had the infection, you have biological protection. That's fact. That's high school AP biology. That's not even medical school. And that's what the research shows, but somehow that's just not discussed. The second part of your question is, there is some evidence that people that have had the infection, when they get the first dose, they have the same immune response to the first dose quantitatively as a regular person without the infection who had both doses. That's where that's coming from. So if you have the X immune response after 2 doses and you've never had the infection, If you take somebody who's had the infection, gets the first dose, they also have X immune response. So they are sort of fully protected or equivalently protected. That's where that comes from. I don't have an opinion on how that will be, but I do have an opinion that people who have had the infection should not be the first priority to get vaccinated. We should vaccinate the people who are at high risk to die. That's the only reason to do vaccines, is to stop people from dying.
Hello.
Hi.
I want to first congratulate you. It was a wonderful speech, and it had a lot to say.
Thank you very much.
Secondly, is this going to be available to us in a written form that we're allowed to ask for?
I think it's going to be, it's on the internet, if I'm not mistaken, number one. Number two, much of this I'm going to submit as a written piece to one of the Stanford newspapers, because I'm really tired of what's going on, and I'm not going to take it. I'm not going to take it.
Dr. Atlas, I'll be 85 in May, and I've been inoculated, so I'm ready to go. But all summer long, I turned on the TV, and I saw Dr. Fauci and Dr. Scarf telling us what the science was in the moment. And I was wondering if you could elaborate a little bit as to how much of that was science, how much of that was politics.
No, I have no hesitancy in telling the truth. I'll tell you it this way first. I wasn't there. You have to remember, I didn't come in until mid-August. So a lot of stuff was said, and then nothing was said, because then the president discontinued these press conferences. What I saw inside the White House, inside the what's called the Situation Room, where the task force meets, is incredible. It's shocking. It's outrageous what was said, and I'm going to have to write about that one because it's amazing. But it's sort of frightening, the level of knowledge, the lack of knowledge of the current data, and I think the answer really can be summed up as this. These are people who are government bureaucrats. These are people who have worked in government jobs for 30, 40 years. These are not people who are challenged intellectually by other people who come in and say, well, what about this? People like me, and they bring in a dozen scientific papers and go through the data. That didn't happen before I got there. And when you have people who are talking like they're talking now on TV about, well, we should pass this bill or something like this, that's not science, that's politics. So, I think it's tough to say the truth. It's actually easy to say the truth. It's tough to watch people lie about what you said. But a lot of things that were said were sort of difficult to believe, I will say. I'll leave it at that.
To the man who asked if you're going to get to read this, the answer is yes.
Okay.
We have a question on the speaker's left. Oh, I apologize.
Thank you very much for your remarks tonight. They were tremendous, and more so, thank you for your action in serving our country.
Thank you.
My question, you referred to the incredible power asserted by our government to shut down the largest economy known in the history of mankind without having set a goal or a purpose. I recall early on that there was a goal of flattening the curve and not necessarily completely destroying the virus for all time, but trying to get the infection rate to be below the capacities for emergency rooms, et cetera. Whatever happened to that? And what is the goal?
I find myself asking that frequently. You're right, and I remember back in the spring or whenever that was, the press conference, that was a very good press conference, when Dr. Birx explained that we're going to flatten the curve, which only meant one thing. The hospitalizations, they didn't want to have exceed capacity. It had nothing to do with stopping people from dying. If people want to talk mathematically, the area under the curve was never changing. It was simply that they were going to delay it so that A, hospitals could treat people, including, by the way, people without COVID, which they failed to do. But that was voluntary and fear-induced. But the second reason for the delay was at least there was some time for mobilizing resources, ramping up production of personal protective equipment, getting a head start on drug development. These are all rational reasons to temporarily, close things. And you may or may not remember, but President Trump very early on and repeatedly said, we cannot have the cure be worse than the disease. And there is something so obvious and yet so wise about that. It's obvious, but nobody else was saying it. And that is what happened. So you're right, there has now been a complete transformation of the goal to stopping all cases of COVID-19. And it's completely irrational. It is proven to be impossible. And it is so destructive and harmful that it is one of the most egregious failures of healthcare policy, really, in the history of the modern world. I don't know how to say it otherwise.
We have a question on the speaker's left.
Hello, can I ask you a question? Did you know that the Arizona State Legislature is in the process of deciding whether people have to wear masks totally or they can get away with not wearing a mask? And all they have to do is get in touch with our state representative and senators, and you can contact West Valley Republican office. Thank you.
No, I didn't know. Yes.
Thank you. Good evening. Thank you for being here. Two-part question. The first is expressing a conundrum that I myself, and I think probably most of the people in this room feel, is a strong desire to rise up. We feel powerless to make a difference in a world that is forcing compliance. If you want to shop at Home Goods, if you want to go to Home Depot, if you want to go to the grocery store, if you want to live your life, you must mask up. If you want to fly, if you want to eat while you're flying, it's up and down with the mask. What is your advice for those of us who choose to believe the science as you have described it, to rise up in a way that is impactful and can change the way and the course that we are facing? The second part, unrelated, is around the power of local public health officials to determine local public policy and health policy that drive the local policies that are really impacting how we're living our lives. Thank you.
Okay, so the rise up quote, by the way, means make your voices heard. I know that, a lot of people went insane when I said that on Twitter. Rise up means stand up, make your voices heard. That's what a democracy is all about. And so what I mean by how you would do that is exactly that. You must be aggressively contacting, meaning be vocal, contact your representatives, your local representatives. You have to basically, we have to make sure that the people in charge are accountable to the people who are in the population. And they're not accountable if we just sit there. And so, I have spoken many times to the San Diego business community as one example. And, these people, they want to open their businesses. And so they have their city council members sit in on these meetings. It's all about, we are the people in charge, in theory. And so we have to show it. It doesn't mean do something destructive or violent or anything like that. That should be obvious to any fair-minded person, what we're saying here. But that means be on the record, say what you want. I mean, the people of California are rising up. There's a recall vote going on with the governor. Now, the second part of your question, there's no simple answer to the question. There's no magic wand here, but it means, actually try to be impactful in your local, communities and get together as groups. Because I was saying earlier that the individual person who owns the gym, who wants to stand up to just open, okay, that person is squashed. And it doesn't work. But it works if everybody opens. It works if all the restaurants say, you know what, we're open. It works if the businesses say, listen, we think we can open. If you don't want to go to a restaurant, don't go as a customer. That's what I say. If you don't want to go to a gym, don't go. Now, the second part is these local public health officials, which is really incredible. This is, again, something that we never knew, we never understood. Who had this kind of power before? I live in Santa Clara County, which is probably the most restricted county in the state of California. And it's out of control. It's insane. Their numbers they're putting up make no sense. It's beyond arbitrary. What they're saying are these guidelines and measures to open. And so the answer is, and this is beginning, there is now scrutiny as to who these people are and who are in these positions, because they never had any impact before. They were really non-entities in a sense, at least not impactful in our daily lives. They have created, by their actions, a spotlight on themselves. And that is the answer, is that we need to make sure that we are on top of these people. These people are officials. They're not in charge unless we let them be in charge. So, this is sort of a gradual process. It's an education for all of us. No one knew about these people. I don't think any of us had ever, interacted with these people before. So we need to make sure that we are holding these officials accountable, even at the local level, not just the state level, the local level. They have tremendous control of your lives.
We have time for one more question.
Yes, Dr. Atlas, thank you for being here. It's a pleasure to hear your expertise this evening. I'm just wondering, as one who is choosing not to get the vaccine, could you possibly give your opinion or speak to the effectiveness of hydroxychloroquine or ivermectin as treatment?
Okay, we're going to hit all these hot topics. So there's a lot of controversy about all these drugs. I'll give you a little bit of my view of what happened with hydroxychloroquine. What happened with hydroxychloroquine was, we had a radioactive president prematurely say, this is absolutely magic. Tremendous amount of internal hostility toward the president inside the administration, massive, shocking, that was going to do anything it could to block that. This is my opinion. And then there was a lot of premature data that came out that was simply like anecdotal. And poor studies were then done that were looking at it in late stage or later stage disease, when most people did not think that's when the drug would be effective. And so it got sort of a steamrolled negative thing. If you read, there's a couple papers by Joe Ladapo and others. He's a UCLA physician who did a compilation of the research on hydroxychloroquine. And it's pretty good data. And there's a lot of studies out that show that it seems, I'm not an expert on that data, by the way. I haven't really spent a lot of time looking at it. It seems that it's effective in early disease and possibly, but we don't know, it's at least being studied for prophylaxis. Like you take, and I have taken hydroxychloroquine for malaria prophylaxis many years ago. But it's thought if it's effective in early stage disease. Ivermectin, I don't know much about, but it's sort of, there's very positive data about it. That again, a lot of these studies are criticized because they're not these perfect randomized controlled studies. But as we all know, haven't seen a lot of randomized controlled studies about masks and 6-foot social distancing. By the way, just sort of an interesting aside that has nothing to do with their question, but you know the WHO says 3 feet. And many countries use 3 feet. Now, why is that important? It's important to know because A, it shows how arbitrary the rule is. It's not that 3 feet is the right number, I'm not saying that, but it also shows if it's 3 feet, that's a game changer for a restaurant, for instance. You know, because 3 feet away, I mean, unless you're with the person, you're not sitting 3 feet, you know, usually. I mean, there are certain restaurants. But so, you know, these kinds of things are just pointing out how arbitrary these rules have been. It's clear social distancing will eliminate and will stop the spread of an infection. And my analogy is if I'm in Paris and you're in London, you're breathing the same air generally, but you're not going to get it. You're far enough away. Now, I don't know about 6 feet. No one knows. It's never been proven. And there's a lot of horror stories about how the 6-foot rule came about in that Situation Room, but it happened before I was there, so I won't claim to know that, but it's a joke. The drug studies have been perverted. The whole climate has been destroyed by the politics, and it's very sad because, frankly, in my opinion, people were killed because of the politics of stopping the drug data from coming out.
Please join me in thanking Dr. Atlas.